You've probably done it. Typed a weird health question into ChatGPT at midnight. Maybe a symptom you couldn't explain or a lab test that terrified you. AI is instant, it's available, it doesn't judge. But using it the wrong way, it can send you into panic or into danger. My name is Doctor Ahmad Saab. For over 15 years as a family physician, my work has been about more than just diagnosing illnesses. It's been about building relationships and understanding the complete story behind each person who walks into my office. Because true healing involves trust and human connection. I've had the privilege of guiding thousands of patients through their health journeys, from the confusing first signs of a new symptom to managing complex long-term conditions. In that time, I've seen medicine evolve in incredible ways. And now, we stand at the edge of another great transformation, driven by artificial intelligence. This new reality presents a challenging duality. I've seen the entire spectrum, the brilliant uses of AI, and the dangerously wrong ones. I've seen patients arrive terrified after a late-night search, convinced by an algorithm that a minor issue was a terminal illness. But I have also seen patients come in empowered, using AI to organize their symptoms and medical history so clearly that we could reach a diagnosis faster and more efficiently than ever before. So I'm not here to tell you to stop using AI. That would be like telling a carpenter to ignore the invention of the power drill. My philosophy is simple. AI should be a tool for augmentation, not replacement. Used correctly, it can empower you to become a more active, informed partner in your own healthcare. It can help you prepare for your appointments, understand your test results, and manage your health between visits. It can strengthen the doctor-patient relationship, not undermine it. The key is knowing how to use it safely and effectively. So today, I'll show you exactly that. We'll walk through the practical ways you can use AI to your advantage, turning it from a source of anxiety into a source of clarity. And I'll give you the non-negotiable rules for when you must put the technology aside and call your doctor instead. Let's learn how to make AI work for your health, not against it. The AI health revolution isn't some far-off futuristic concept. It's already here, quietly weaving itself into the fabric of our daily lives and the healthcare system. It's not always a flashy robot in a lab coat. More often, it's the invisible intelligence working behind the scenes on your phone, on your wrist, and in your doctor's clinic. This powerful convergence of massive data, incredible computing power, and advanced algorithms is evolving at a breathtaking pace. Understanding its role is the first step to harnessing its power safely, and people are embracing it. A recent study found that 1 in 6 adults now uses an AI chatbot for health questions. It's easy to see why. When a strange symptom appears late at night, the desire for an immediate private answer is powerful. The perceived lack of judgment from a machine can feel comforting, especially when dealing with sensitive topics. But this convenience is precisely where the risks begin to surface. In the clinical world, AI is already a powerful partner. In radiology, it acts as a tireless assistant, triaging thousands of scans to flag the most critical cases, like a potential stroke or internal bleeding, for immediate human review. It helps dermatologists screen for skin cancer with incredible accuracy and assists primary care doctors in making better referral decisions. The key here is supervision. The AI suggests, but the trained clinician always confirms. Behind the scenes, it's streamlining tedious administrative tasks, from intelligent scheduling that reduces wait times to helping get insurance approvals, freeing up clinicians to spend more time with patients. It can even listen in on our conversations with our consent, of course, and generate a perfect summary of the visit, ensuring you and your doctor are on the same page about the plan. This is called ambient documentation, and it's a game changer for reducing physician burnout. When used correctly, AI has the undeniable power to make healthcare more efficient, more accessible, and more accurate. It can democratize medical knowledge and empower patients like never before. But this explosion of technology also creates a wild west of health information, where it's difficult to separate fact from fiction and help from harm. The internet is flooded with information, and AI can amplify both the good and the bad, with equal and often misplaced confidence. This makes it harder than ever to find reliable guidance. It's crucial to understand that the general-purpose chatbots you might use every day are not specialized medical instruments. They are not regulated by the FDA as medical devices. Their programming is not designed to provide a diagnosis, and their knowledge can be outdated or, in some cases, completely fabricated, what we call a hallucination. They are pattern-matching machines that lack the context of your life, your history, your unique biology, and a physical exam. This brings us to the single most important principle for navigating this new world. So, rule number 1 is simple, and I want you to remember it every time you interact with these tools. AI is a powerful resource, an incredible assistant, but it is a tool, it is not your doctor. It can inform your conversation with a healthcare professional, but it can never replace it. AI is fantastic for preparing for your doctor's appointment. Tell the AI your symptoms in detail and ask, what key details should I tell my doctor? What questions might my doctor ask me? What tests are sometimes used for this symptom? AI helps you walk in prepared, confident, and organized. Medical jargon is a foreign language. AI can translate it into plain English. Ask it, explain this lab result in simple terms, like you're talking to a patient. This builds understanding without jumping to conclusions. AI-powered devices like continuous glucose monitors or smart BP cuffs analyze trends you'd never notice. They help you catch issues early but must always be shared with your doctor. AI can check drug interactions, remind you about doses, and explain side effects. Use reputable apps and never replace your pharmacist's advice. AI can personalize advice on sleep, diet, exercise, and habits. But remember, it doesn't know your medical history. Treat its advice as guidance, not a prescription. AI chatbots can help with stress, mindfulness, or relaxation meditation-based exercises, but they must never be used for crisis, self-harm risk, or serious mental illness. Use them as a supplement, not a substitute for care with your own mental health professional. AI cannot examine you. It can't listen to your heart. It can't detect danger signs. It often hallucinates and invents medical facts. Use its output only as discussion points, not answers. Most public chatbots are not HIPAA compliant. Never enter your name, medical record numbers, doctor names, full reports, exact dates, summarize anonymously instead. Chest pain, stroke symptoms, or severe pain. Never type these into an AI. Call 911 or get emergency care immediately. AI may give outdated medical info or biased advice based on skewed training data. Always check sources and ask for citations. AI can't replace empathy, context, or judgment. Use it to prepare, but always trust your relationship with your real doctor. Use detailed anonymous prompts. Ask for possibilities, not certainties. Ask for pros and cons. Ask for sources. And stop using AI when symptoms are serious, scary, or worsening. We walk through Sarah, a realistic example of unsafe versus safe AI use. Safe prompting leads to better understanding, better doctor visit, and helps with possible real diagnosis. We've covered a tremendous amount of ground today, from the incredible potential of AI in healthcare to the critical guardrails we must respect to use it safely. We've seen how AI can help us prepare for doctor's visits, decode complex medical jargon, and even support our mental wellness journey. But we've also established the non-negotiable rules. AI is not a doctor. It cannot diagnose, it must not be used for emergencies, and your privacy is paramount. The goal isn't to find an answer in a chatbot, but to find better questions for your physician. AI is here to stay, and when you use it the right way, with the principles we've discussed, it can transform you into a more informed, more empowered, and more confident patient. It's about shifting from a passive recipient of care to an active partner in your own health journey. This technology, when harnessed correctly, bridges the gap between confusion and clarity, empowering you to have richer, more productive conversations with the healthcare professionals dedicated to your well-being. That's exactly why I created the Doctor AI Symptom Checker, which you can find at app.myaidoctor.ai. I built this tool from the ground up with a single guiding philosophy to augment your ability to communicate, not to replace the crucial role of your doctor. It's designed specifically to help you organize your symptoms into a coherent timeline, to understand the potential causes in plain, accessible language, and most importantly, to prepare a thoughtful list of questions for your real doctor. Think of it as a pre-visit organizer. It takes the jumble of worries and symptoms you might have and structures them into a clear narrative. It helps you remember the details that matter. When did it start? What makes it better or worse? Have you experienced this before? By doing this work beforehand, You're not just saving time during your precious few minutes with your clinician, you're fundamentally elevating the quality of the entire clinical encounter. If you've ever felt that familiar sense of being rushed during a doctor's visit, or walked out of the clinic and had that sinking feeling of, oh, I completely forgot to ask about, then this tool is for you. It's for anyone who has ever felt their mind go blank the moment the doctor asks, "So, what brings you in today?" This tool helps you walk into that appointment prepared, organized, and confident. It ensures that your concerns are heard because they are presented clearly and concisely. It empowers you to lead the conversation about your health, ensuring you cover all your points and leave with a clear understanding and a solid plan. It's about making every minute with your doctor count, transforming a brief check-in into a meaningful collaborative discussion about your health. It's about turning anxiety into agency. So, I invite you to take the next step. After this video finishes, open your browser and go to app.myaidoctor.ai. Take a few minutes to try the symptom checker. You can use a real symptom you've been wondering about, or even a hypothetical one, just to see how it works. Experience firsthand how it can take scattered thoughts and transform them into a structured, useful summary. See how it generates clarifying questions you might not have thought to ask. This is not a diagnostic engine, it is a conversation starter. I believe you'll find it can fundamentally change the way you prepare for and participate in conversations with your doctor. And as we close, I want to hear from you. If this guide was helpful in demystifying the role of AI in your health, please take a moment to like this video and subscribe to the channel for more content like this. More importantly, share your own experiences in the comments below. How have you used AI for your health? What tools have you tried? What worked well for you and what didn't? Your insights are invaluable, not just to me, but to everyone in this community. In this new era of medicine and technology, we can all learn from each other's journeys, successes, and even missteps. Your story could be the key that helps someone else navigate their own health challenges more effectively. Thank you for investing your time with me today. Remember the core message: use these tools to become a better partner in your own care. Never substitute them for professional medical advice, especially in an emergency. Stay safe, stay informed, and be well.